Would it be better if I just left these arms in the back? Just know where.
Just to show where they are, sure.
Cool. Alright, cool. Alright, we'll start. I will. Yeah, Heather already plugged it in. Awesome. Well, we'll just start with turning on the machine and then setting up on a non-sterile versus a sterile setup. So, she's plugged in, just in the back. All power button, just right in front. Cool. As it loads up, we can go ahead and put one of the arms on the bed. So there are two arms that go on each, one that goes on each side. We went ahead and put one on just to see how it looks in relation to the stirrup. So it is going to sit in front of the stirrup on these, so the legs will be in higher lithotomy than you're used to. Each arm has a specific orientation. So this arm that our handpiece attaches to always goes on patient left. I already put a label on it, patient left. And then they will also be oriented in this upward position with the joints. So I put a label as well. So the side that faces up, I just put up, up, and up. So, if it's like this, you can just press the trigger, orient it how you want it. If you guys are familiar with these arms, the trigger releases everything until you let go. Okay. You guys can have practice if you want putting on this arm. But cool. As soon as this arm is on, we put the arm that's the opposite side of what the patient is coming in on, just like you would with the stirrup. So as soon as that side arm is on, you can come back and take a look at the screen, and we can go ahead and start checking off everything that we need to check off. Again, we're still on our non-sterile setup. Foot pedals already going to be connected. Foot pedals just in the back here. You can always leave that one plugged in. The other two that you can connect just while you're setting up is our ultrasound probe. So our probe comes in this container. It does go through SPD. So while it's getting sterilely processed, you still can set it up non-sterile. So it'll be wrapped, but whoever is a nurse in the room can just go ahead and open it. I know that's kind of weird, but it's just for cleaning. But yeah, we set it up non-sterile just because this is going through the rectum. So you guys can come up here if you want to plug it in. Every component just plugs into one spot. So that one goes right here. Push it and turn that back down. That's all. So always just check up here if it gets checked out. So truss is checked out. And the other thing that you can plug in is this motor pack. We draped it earlier for practice, but I'm just going to leave this draped on. But this lives in this drawer. Just grab it out of the drawer and you can just plug it in. With the arrow up, just push it in under it. That's all. And then this will be good. So, motor pack, truss, foot pedal, arm. That's everything on a non-sterile setup, like as you guys can set up before a patient falls in the room. Now we can move over to what we would set up on a sterile setup. You would set up whoever scrub tech will set up everything as they would on the back table, as they would a turp. So, what you'll need for this case is everything for a turp setup, as well as these two components that will be pulled. This is the handpiece, which have these components in here. And then we also have a disposable drape pack as well. So these are the two disposables. In this drape pack are one patient drape and 3 camera drapes, which that's one of them right there. And the other 2 camera drapes get draped over that arm, and then this arm that goes on this side. Cool?
The other thing for the nurses that you'll need is the suction canister down there, the disposable one.
Sure.
And then you are going to need 3,000 bags of fluids. You're going to need one of the bags hung over there, and then the other bags will be hung over by your neck tube.
Yes, thank you for that. So that will also be something you'll have in that. Yeah. So total for these cases, 4 to 6 bags, but one right here, 2 there, and then 2 back up, ready to go. Cool. This bag is for the actual water jet resection, and those 2 bags are for the flow that he usually uses for tour. So he will have a resectoscope ready and set up and used just like we would a tour. He uses that part just to clean up the bleeding after aquablation is done. So it's not a full turn, but it's the same setup and same. Cool. So back table is set up. You'll also have a nail stand cover. So what we can do is I will act as a scrub tech and just hand off what needs to be connected. So this will be sterile right here, and everything right here will be the rest of these connections, essentially. Cool? Whoever, all right, you got it, man. You're the aquablation man. Okay, so when we open up that white box, when we hand these off to you, it doesn't matter which one gets handed or connected first. So we hand you the arrow end of that, as well as this one piece. So you'll grab both of those. All of these only connect in one spot, so you can't go wrong. So this one connects right here. Yep, that feeds through that. This feeds through this aspiration. Yep. And then you can just drop it out. Cool. My non-arrow end connects on this. Cool. Now I'll hand you this. It doesn't matter which side you connect that. Right here. We've been using that a lot, so it may or may not work, but yeah, it's in cystoscope. And then these 2. These 2 are like connected, but they both go to you. That one will just spike over the 3,000 bags that we'll have here. Yep. And then this connects. Just push it all the way in and then push this down. There we go. Water jet cartridge. Cool. And then the last thing is, we already connected this. We won't have a drape, but how we do this drape is there's a camera drape that whoever's scrub tech will just open up one end. You'll drop this motor pack in, and then you'll drape over. And then they will feed this whole top piece through this little hole. And then connect. You guys are all nurses, yeah? Mm-hmm. Okay, cool. And then that's everything connected. And then to do the priming, that will be connected to 3,000 bag, and you'll just hold down that prime button on the foot pedal until all the fluid goes through the clear tubing. You just hold it. You just hold it down with your foot until it checks off. Sure. And that's that setup. Another thing that we will do on the day of, we'll show you on the day of cases or the day you are in these cases, is there's a probe cover. We fill the probe cover up with 2 packets of ultrasound gel, and you put it over and tape it around. But we'll show you that technique later. And then so we'll essentially set all of this up before patients in the room. Also, ideally, we want this machine on the opposite side of what patient would be coming in. But again, this is a large room, so this would work. This is enough room to move all this back, patients coming in through there. Through there, right? Yeah.
So just to be clear, we're gonna say that again. So, Hydros machine goes on patient left or right?
It goes on any side.
Whatever other side of what the patient's coming in, opposite side of patient entrance, I guess.
It would come in on the right, but our rooms are pretty big.
But if these rooms are big,
I see.
this works.
Okay.
Yeah, so honestly, situational.
Got it.
Now, patients on the bed, I'm going to practice putting this thing on. So this is our patient right arm. So honestly, you can use your left to just grab the trigger. You can grab it how you were, and just use that to. Yeah. So it'll. So I'll show you first. Just hold it like this. That's just unscrew it a little bit, and then just. You can either slide it over just like that, or you can put it away. Cool. Now, just tighten it up.
Should we push it down to where there's a little clip on this bed that holds it on secure? Should it be right to the edge? Yeah, I'll show you on this side.
Yeah, I know what you mean. Yeah. Either or.
Okay, there's not a, it doesn't have to be pulled all the way back.
We like it right on the edge.
Okay.
Just just to have more clearance for the leg as much as possible.
Yep.
That's perfect. So you just check, just make sure it's not light, and then once it's on, now just use the trigger to move it to the right range. So I've already labeled what's up. So on this one, it gets. So you see now it's up, and then the trigger faces in. So this right here is the orientation. Needed.
And on that side, everything is up.
For the, yep. Oh yeah. This one, you can go ahead and put it on this one. This dial is. So these are the final orientation. So once that arm is on, this is the arm that holds the ultrasound probe. You can drape this non-sterile. So we have 3 camera drapes. One of them, the scrub tech will drape that one sterile. This has already been used. That third one, you will drape over this arm, non-sterile. Just grab the slat and tie it around, and then you guys can practice putting this on. You'll put this over the drape on this one. So you loosen it by loosening that, slide that over. Yep. There's a little horseshoe thing. Yeah. Now, feel underneath here. You feel where that horseshoe, you feel that? You'll push forward until that's flush, right there. You feel that? And then you tighten it. Yep. Cool. And then whenever patient legs are going up, we'll move the machine closer and put the probe on. So the probe essentially fits on this like this. So we'll put it on the second latch, and this is like a little Lego piece that just latches over. That's how it's positioned. Before he goes in with the probe, he'll have 60 cc's of KY captive syringe. So for these cases, we'll need KY jelly and ultrasound gel packs as well. The ultrasound packs are for the probe cover, and the KYs for his captive syringe before he goes in with that in the rectum. Any questions about all this setup? Does it seem straightforward?
Just to be certain, we do have a rep that will support several cases.
Yeah.
If we're sending specimens, where we taking it from? Where are those coming in?
There's not really. There will be some chips that will be collected in. So I didn't explain this. There's a patient drape that goes over the legs, and it also has a pouch. So there won't be a ring needed So in that pouch, sometimes he will collect specimen from there, you guys will. Or prostate chips.
So what's going into that canister?
During the actual aquablation procedure, so it's a handpiece that goes to your urethra. He maps out everything on the screen, presses on the foot pedal, and it's just water jet resecting. So all of the fluid that's going in comes out at a 1-to-1. So that's just collecting all of it.
So if you have a 3,000 bag, we're gonna need a 3,000 canister.
We will not use all of that 3,000 fluid usually, but because that's a smaller canister, you will also put a suction tube in there. and connect it to the tube. If you're wondering why we won't just,
You can't just connect that to the
yeah, that's what I was gonna say. If you're wondering why we don't just connect it straight in,
Yeah.
it's because everything, the fluid goes at a 1-to-1 out of the patient. If it's connected to Neptune, it kind of sucks it out faster than 1-to-1. And kind of we need it to be 1-to-1 because if it's faster, it'll shrink the planning and mess with the thing. But yeah, I know. But you can put suction in there and just so it doesn't overflow. So we'll need 2 suction tubings for these cases. One for that, and then one to connect under the pouch. So, quick rundown of
So
the.
if it's suctioning out of the pouch, will you be suctioning up what he may be using for specimens? Or not, it's not gonna be suctioning?
That
up
should
enough?
just suck out the fluid.
Okay,
Usually, most of the time, the chips are still
okay.
left at the end. So, quick overview of the case. As soon as this is all set up, like this, he will come in. So next Thursday, we'll watch starting. He will come in, put in 60 cc's KY, put in the probe, map it out. He'll do this non-sterile, pretty much. And as soon as he has that set up, then you'll go sterile. He'll gown up. Scrub tech will put a patient drape on. That drape will be sterilely covered. Then you will pass off the normal camera, light port, cysto tubing, which will connect under. So we'll go ahead and set up everything that needs to be connected for his resectoscope part. And you'll have the resectoscope ready. It's up to you guys. A lot of places just leave the resectoscope on the belly while they do the aquablation part. So as soon as that's all connected, then he'll grab this and start the case. He'll go in with this, connect it to the arm, do all of the planning, press on the foot pedal. There will be 2 passes of aquablation. So it'll be like 2 3-minute passes or something. Everything total right there should take like 15, 20 minutes. And then he'll go in with the resectoscope afterwards and start looping and cleaning up the bleed. Because this is a room temperature water jet that cuts the prostate. The benefits are patients can preserve sexual function and it can be done faster than a joke for any size prostate. As soon as he's done, but anyways, as soon as he's cleaning up with the bleeding, during that time we can tear down all of this stuff. So he'll hand this back out to us, and then we can use this nail stem to tear this stuff. And then, as soon as he'll usually keep the probe in during his resectoscope, so that he can see the view as well on the prostate. And so then we can tear down the probe after that. To send the probe back to SPD, take this off. We'll remove the probe cover, and you will put the cap on. Put the cap, screw it on with the towel, wipe down any fluid, put it in that container, and send it out. Whenever we get this, we should always be given this with the cap off, because it goes through the sterilizer with the cap off. they clean it, the high level disinfection, hand wash with the cap on, and then cap off for sterile. So if we ever get this with the cap on, we'll gotta let us be again. Because that, with the cap on going to sterilizer, will look pretty close. Yeah, that's again, we will be here, especially for those all of the first initial case series.
What is that other screen for?
Once, oh yeah, it's just for the doctor. So this is his screen.
And these will
This
not
is
be
just
routed
this is just
around
our
the
other
roof
screen.
in
If
our
there needs to be
research.
trouble, if there needs to be troubleshooting, we'll use this screen. What was that?
They will not be routed around to other monitors during the case.
No.
If this is on that side, does the probe cover just like go underneath the bed to go on the left side?
If this was ended up being, yeah, go.
Same with the GM.
So during the case, yeah, we'll see the cysto image of this on here, cysto and ultrasound, and then it will be that screen that we use for the second. It should average times for all of these, no matter, should be about 45-50 minutes for operative time. Yeah, not including surgery, but yeah. Oh, y'all have any other? Another thing is the foot pedal in this box. There's a sticker box, like a sticker bag that holds all the stickers. That bag fits perfectly over our foot pedal, so we use that to cover our foot pedal. Pretty much looks like this size, pretty much.